And good morning, everyone. Indeed, the Chew with Dr. Drew. And welcome again, Dr. Drew Markham.
Thank you.
It's nice to have you here again. This is week 4. My time is flying. The first week we talked about an overview of general dentistry and your practice. And then in week 2 we talked about the fears. That was pretty crystal clear,
Yes.
I think. And I've had a few of those experiences. Then we talked last week about money. And I think we might pursue that a little bit today as well. But I think today we're going to talk about the health issues surrounding continual oral health.
Sure. And, a lot of times when people come into the office, of course, the expectation is for us to look at the teeth themselves. But our scope of practice goes beyond that. And certainly, the gum health is something that's very important and something that has taken on greater meaning over the last couple of decades as new science comes out to show the relationships between gum disease and things like cardiovascular disease, diabetes, and even some cancers are showing some relationships, not necessarily a cause and effect, but we take that very seriously.
Now, how does that happen, that there's a relationship? I mean, I'm incredibly a layman, when it comes to medicine and research.
Some of the speculation, because it hasn't been completely fleshed out, is that for people that maybe don't take as great care of themselves, there's a lot of extra bacteria in their mouth that can then get introduced into the bloodstream and lead to certain issues. So that's one of the theories that's out there.
So what can we do to avoid that?
Well,
I know the suggestion is to go once a year or
twice a year and that
yeah.
sort of thing, and a lot of those are based in insurance plan recommendations and that sort of thing. But
because
the truth
they're highly skilled in dentistry to understand that.
Yes.
You have to pardon my being sarcastic.
Yeah, no worries. But the truth is that a lot of our adult patients we see 3 or even 4 times a year, and the truth is that when your teeth are cleaned professionally, the bacteria start to repopulate, and after a certain period of time in that 3 to 4 month range, some of the more harmful bacteria that can lead to things like bone loss start to become more prevalent. And so, the hard part is when you're having a discussion with a patient, almost all of this stuff we're talking about is painless. And so it's going on unnoticed. Maybe there's a few signs, but because there's no pain associated, often people rightfully so wish that everything seems okay, but it isn't necessarily.
You use the analogy that if we cut our skin, like if we cut our arm, we go, I should put a Band-Aid on that, or if it's even worse, I should get it sutured. And when we don't experience this kind of oral pain, there are still things that occur that unless we go regularly, probably more often than every 9 months, we're not going to know that's happening.
Absolutely. The philosophy that we have is healthy tissue doesn't bleed. And I remember as a youngster myself, when I wasn't taking great care of my teeth and I would go and get my teeth cleaned and they would bleed, of course I would rationalize saying, well, you're poking me with those sharp things.
Right.
So of course it's going to bleed. But the truth is that, with a skilled hygienist, which hygienists are fantastic at scaling teeth, if there's no bleeding, that will indicate that the tissue is healthy. And so, again, if any other part of your body was bleeding spontaneously or under light contact, you would probably see someone about it, and we take that seriously in our practice.
I remember being younger, and I would brush my teeth, and we were told, when we get up or after we eat in the morning, and then
Sure.
before we go to bed. And I would notice light bleeding from the gums. Is it because I was using a really hard toothbrush, or was there some issues, do you think? I mean, I know we're speculating here. And what is the recommended texture of a toothbrush in your expert opinion?
I think it's pretty widespread and believed amongst most dentists that using a soft brush is going to give you everything that you need. Obviously, there is the mechanical removal of bacteria and plaque that's going on. Depending on the kind of toothpaste you use, you're also trying to apply different things, whether it be fluoride or things for, even whitening, gum health, sensitivity. You're applying that to the teeth as well. So it's not so important to have a hard brush because, that can traumatize the tissue. So more likely it's because of the inflammation that results from the bacteria that are present that lead to the bleeding. It's your body's way of trying to fight that localized infection.
Wow. Now tell me, you mentioned this earlier, about bone loss. How does this occur? And when would I become aware of that, or is that maybe one of those issues that if I don't feel pain, it's not happening?
Well, no, bone loss can happen without pain as well. The early stages of gum disease are more of what we call a gingivitis, where it's affecting just the soft tissue. But left untreated, it can eventually start to erode the bone away. The bacteria are toxic, and so the bone essentially gets out of the way, and that can eventually lead to teeth loosening, again, largely painless. And so that's where to identify that, usually either through x-rays or some of the probing that we'll do in the office, which I know a lot of people don't love. But
well, I think it's the word.
Sure.
I think the word that
and
scares
we try our
us.
best to find words that make sense. But what we're doing is we're measuring where the bone level is relative to the gum tissue. And so that can give us a determination as to what stage of bone loss may be present and help us guide what treatment options there are available.
Now, you mentioned an analogy when we were talking off air, comparing oral health and being conscientious about it to being diagnosed with high blood pressure that can't ever be healed. Or
most of the time when someone has a blood pressure issue, they're managed for the rest of their life, whether it be through medication or diet or other modifications that way. And there are very few people that are cured of blood pressure. And gum disease is the same way. Once it's happened, all the settings are present for it to continue on. And so that's where maintaining frequent, recalls in the office is important to not allow that harmful bacteria to take hold again and then restart that process of bone loss.
Now, for a person who wears, I was going to say false teeth, dentures is the proper.
Yes.
Now, this is another issue that needs to be continually maintained in a really hygienic way.
Yeah, and it's interesting you mentioned that. Certainly for anyone of my era, and probably still today, the recommendation with any sort of plate is to take it out at night. And the reason for that is to allow the tissue to breathe, obviously to allow for cleaning of the acrylic and whatnot, and the tissue underneath. But I've started to get away from that. Obviously, I still want people to take them out in order to clean them, but the fact is that especially with complete plates, if you take them out at night, that can actually collapse your airway and lead to breathing issues. So I would much rather have someone with a little bit of irritation on their gum tissue than have a breathing issue. So certainly we have conversations with patients about that when they're unsure.
Now, is it more advisable to go implant?
Implants have come a long way and are really an excellent restorative option. And the fact is that with certain plates, they're not really very stable because the bone underneath just isn't prominent enough to hold that in place. And so implants are a very good option to help provide additional stability underneath prosthetics. Absolutely.
Now, if there has been, some bone damage, does that affect your decision whether to implant or plate?
It's certainly part of the conversation, absolutely. Part of it, too, is whether it's the upper versus the lower. Lower tends to be much more problematic in terms of plates moving around. And so in those cases, if we can even save a couple of teeth, we'll absolutely do that.
As an anchor?
Yes. Whereas, implants then become an artificial anchor that can work. And so lowers are where we absolutely tend, and it's becoming much more the standard of care.
Wow. Before we go, do you have any final words for this morning?
Well, I know that we cover a lot of information on these chats, and it can be a lot to process, especially for someone who's thinking about having work done. I know our website is really been done very well in terms of how much content is on there, and we have some actually really neat stories about people who have had difficulties at the dentist previously and their experience.
Yeah, I have the website up. It's really informative.
And that's drdrew.ca. So, there's a lot of information there, and people can contact the office through that if they have questions and that sort of thing.
Excellent. This is the Chew with Dr. Drew. The Chew. I need a new upper plate. The Chew with Dr. Drew. We've been speaking to Dr. Drew Markham, and we'll be continuing for another few weeks. His practice is Dr. Drew's practice is located at 110 North Kitten Avenue in beautiful Huntsville. You can contact the office by going to drdrew.ca or directly by telephone at 705-788-3067. Is on Facebook. And Dr. Drew, thanks again for being as informative and candid as you are each and every week.
Thank you.